Hi there, I'm Dr. Alex Ye, and today you're going to check out a live cosmetic procedure that will involve 2 crowns and 6 veneers to do a smile makeover for a patient. Okay, right now we're getting ready to freeze the patient. We've already applied the topical anesthetic, so she'll feel minimal pinches. We're administering local anesthesia. These are just infiltrations I'm giving. We're going to be working on teeth number 1-4 to 2-4, premolar to premolar. The crowns will go on the premolars and the veneers will be on the anterior 6 teeth. I believe one of the canines I end up doing a full coverage crown. So here we are doing the incisal reduction for the 2 central incisors, and then I'll work my way backwards on either side. I like to use new diamond burrs and just because they'll cut more efficiently. And I'll actually change out the diamond midway through to a new diamond, like midway through the procedure. So here we're trying to be as conservative as possible, but also removing enough tooth tissue to achieve the cosmetic result, the desired cosmetic result. A lot of people underestimate how much tooth structure needs to be removed, although it is just most of the time only a millimeter or a millimeter and a half of reduction. When you do it on 3, 4, or 5 sides of the tooth appears to be much smaller than when it used to be. And so a lot of patients are surprised by that. All of the tooth structure that's being removed, the enamel and or the dentin, will be replaced with porcelain. Insufficient tooth reduction will compromise the cosmetic result. It will not allow the dental laboratory to fabricate the correct size or symmetry of the restorations. So although we are trying to be conservative, we're also trying to achieve that result, that cosmetic result that the patient's after. Again, these teeth, like, it's not clear from this video, but these teeth have all been heavily restored with tooth-colored filling material from previous cavities and fillings. So a lot of the tooth structure that we're removing is actually not tooth structure, it's actually just filling material. So you can see, for example, if you look closely enough, you can actually see that most if not all of her teeth have been filled and refilled and patched up. And so the porcelain veneers and or crowns will actually help to reinforce the structural integrity of the teeth. When you compare porcelain, well, there you can see on the x-ray, you can also see, if you look closely enough, you'll see that there's quite a bit of filling material that were on the teeth before. A lot of that's being prepped out during the preparation phase. And so when you actually think about it, a lot of the reduction is actually not natural tooth structure. It ends up being mostly restorative material, like filling material anyways. And so we're replacing filling material and tooth structure, natural tooth structure, with porcelain, which compared to regular just composite filling material is considered a superior restorative material. So right now we're just placing packing cord, and I'm pushing the gum tissue up a little bit so that we can get the margin of the crowns and veneers tucked at or below the gum line. Now, this patient also has a slight gummy smile. And she does have a lot of free gingival space, so we are electing to use a laser to reduce the height of the gingiva so that her crowns can be taller towards the gum line. So this procedure is considered non-invasive. It's not a surgical procedure. although it can be, you can use a scalpel to do it, but I've elected to use a soft tissue laser. And so we're just going to trace around the margin, and then we're going to drop the margin, or raise the margin in this case for upper teeth. We're going to raise the margin of the porcelain restorations so that they are at or below the gum line. Her gummy smile will be reduced by that lasering procedure, that gingivectomy procedure. So here I'm just re-preparing the margins again. So we've got a little hemorrhaging, which we're going to control with an astringent solution. So the other thing I'm looking at is parallelism. So I try to make all the walls, most if not all the walls of the preparations parallel to each other and parallel with the path of insertion that we want. So right now we're getting set for the final impression. So we're going to do this old school. We're not going to scan it. We're going to use light body, heavy body. Before we do that, I'm going to take a bite registration. So this patient is going to bite into this purple bite registration material in a regular CO bite with her prepared teeth. So the lab will be able to mount her upper and lower casts accurately. So I'm just tucking in some cotton rolls here to achieve some isolation. We're going to dry the teeth very well. She was starting to feel a little bit of sensitivity, so I'm just giving her a little extra freezing there. We're using articaine. She didn't feel the freezing. So at this point I decided to take some photos as well of the preparations for our records. And now we're applying the light body around each tooth, around the margins of each tooth, and Taylor, my assistant, will be filling the complete upper tray. Wasn't quite enough, I told her to add some more. And I'm actually, you'll see me suggesting a different technique to fill the tray as well to minimize bubbles or voids. So I like to air thin the light body before we place the heavy body. The patient actually has a surprisingly wide arch, so we are using a large tray. So we'll hold that tray in place for 5 minutes, and that is the setting time of the polyvinyl siloxane. So I think there was a couple voids in the impression, which I don't like to see. So we'll take another impression. And here I'm just showing Taylor a better technique for filling the tray. And we're going to dry the teeth again and do this whole thing again. And there, she's filled it in a smoother way. That'll minimize voids. So I'm just air thinning the light body again. Timing is pretty important here because the working time is limited with the polyvinyl siloxane impression material. And if you wait even just a few seconds too long, it'll start setting and your impression will be wasted. You'll have wasted another 5 minutes. Okay, so I've decided to change my gloves. We'll wait the full 5 minutes, and then we'll wet the cotton rolls. I like to wet the cotton rolls obviously because dry cotton rolls, when you try to remove them, in some people it will tear. You'll have little micro tears in the mucosa that could turn into canker sores, and I've learned that the hard way. So I always make it a habit of wetting cotton products that are in the patient's mouth before removing them. So this impression is way better, no voids, very accurate. So here I'm going to help the lab visualize the parallelism of the patient's eyes, the level of the eyes. So I'm setting the horizontal little stick there parallel to her eyes, and then I'm putting the yellow stick, the vertical stick, and I'm making that match her midline so that the lab can visualize the facial midline as well as her eye line, and that'll help the lab fabricate a nice symmetrical smile that is also parallel with her eyes and her lips, as well as matching the midline of her face, because oftentimes people's dental midline doesn't match their facial midlines. When we do smile makeovers, we have the ability to change the midline somewhat. So here I'm doing the temporization process. You saw me applying the temporization material, which is like an acrylic material in the stent, the rubber stent, which is what I'm removing. So the liquid acrylic hardens around the prepared teeth. And there are some voids that I'll just fix with this flowable composite material that matches. It's basically a tooth-colored acrylic, and then the composite just fills in voids that might be there. And then after that, it's just a matter of spending time cleaning up, meticulously cleaning the acrylic around the teeth, on the gums, on the roof of the mouth. It gets kind of everywhere. So we have to take our time and clean that up for the patient. So you see me picking away at that stuff. It goes back onto teeth that we didn't work on, and it's tooth colored, so it's difficult to see. When it's thin, it's actually pretty translucent, so it's difficult to see, and it takes time to clean up properly. So I'm using a very thin mosquito diamond burr to just trace the margins, being careful not to damage the tooth or the preparation underneath the temporary, but at the same time removing any excess temporary material so that it doesn't unnecessarily irritate her gum tissue while we're waiting for the permanent restoration. So you can see the temporary restorations actually look not too bad. They're based on a wax up that the lab made. So they are not based on what her teeth looked like before. This patient had a naturally occurring open bite when she bit down on her back teeth. But when she slides her front teeth forward, she can touch the edges of her front teeth. So here I'm just fixing the bite. I'm making sure her bite's comfortable during the 2 weeks that she'll be in temporaries. And here I'm just smoothing everything out using a carbide finishing burr, and then polishing with an enhanced point, just to make sure there's no little sharp edges or rough spots, so that's comfortable for the patient. And she checks her bite. We'll remove the cotton rolls. Give her a nice rinse. We'll take some photos of the temporaries. So hopefully you enjoyed that video. If you have any questions, you can contact us at smilesdentalgroup.com, where you'll also find our phone numbers to clinics that might be near you. So if you have an interest in general dental procedures, please like our video and share with your friends.